時間又夠啦。
This is the appointed time. We have a quorum. So thank you for attending this first meeting of the panel on health services in this new session. And we shall proceed to election of chairman for the panel on health services. And would members please note Rule 77(6) of the Rules of Procedure. If a member who is a chairman or deputy chairman of a government advisory body in respect of matters which a panel considers to be directly related to the terms of reference, he or she shall not be the chairman or deputy chairman of the panel. And Rule 77 bracket 7 states that the member shall not be chairman or deputy chairman of more than one panel at the same time. And we'll follow Appendix IV, which sets out the procedures for election of chairman and deputy chairman in the House rules. And a nomination should be made by a member orally, to be seconded by at least another member, and the member so nominated must accept the nomination first. Nominations, please. Professor Joseph Lee. Anyone seconds? Dr. Kokaki. I accept. So Dr. Leung would come up and chair the meeting. Okay, members, any other nominations? If there is no other nomination, I declare that Professor Joseph Lee is returned chairman of the panel on news services for the 2015-16 session. So please continue to chair the meeting, Professor Lee. Well, thank you for your support. Let's continue with the agenda. So, election of deputy chairman. Any nomination? Mr. Chan Kin Po. Dr. Leung Ka-lau. Anyone seconds? Mr. Albert Ho seconds. Dr. Leung Ka-lau, do you accept? Yes. Any other nomination? No? Okay, congratulations, Dr. Leung Ka-lau. You'll be deputy chairman. So that's the end of the election of chairman and deputy chairman. And after electing chairman and deputy chairman, we will discuss the schedule of meetings for the 2015-16 session. Will members please note the schedule? There's been a slight change for this session. In October, we were supposed to have a meeting, but having discussed with the administration, since there is no particularly urgent item for discussion, the first panel meeting will be held on the 16th of November. And then the regular meetings will be held on the third Monday of each month, 4:30. And so members please refer to Appendix D. Okay, items for discussion at the next meeting, Dr. Helena Wong. Chairman, of course, we are concerned about lead in water incident. I hope that this year we can arrange for discussion on of the item as soon as possible from a public health perspective, how we can improve water quality. And would Secretary Dr. Koh Eng Man please explain to us blood tests in the lead in water incident and the analysis, and also for the group above the age of 8, perhaps 9, or adults who live in the affected housing estates or in schools. What has the government done to understand their situation? Dr. Elizabeth Quat. Well, Chairman, I hope the administration could discuss women's health with us, including uterine cancer, breast cancer, and the relevant vaccines. We have, and also HPV vaccine. We have mentioned this to the administration before. I would like to hear a progress report from them. Anything else, Dr. Helena Wong? About Kai Tak Hospital, we'd like to know the government's plan. Is Queen Elizabeth Hospital going to be relocated there? I'd like to hear from the government as well. And regulating the beauty trade, last year we discussed it. but it seems that no department will take up this task. I hope that this will be dealt with as soon as possible. Well, last time, at the last joint panel meeting, there was a hearing. I believe Mr. Wong Ting Kwong has received a letter, and after the meeting, a letter was sent to the Chief Secretary for Administration, and we will follow up on this issue. Anything else? Well, if not, then would members please refer to the list of outstanding items for discussion? That's Appendix V. And depending on the urgency of the item, we are going to meet with the administration next week for a schedule of these outstanding items. Yes, Mr. Albert Chan. Sorry, I left something out just now. There is another issue which is not urgent. Ambulance. There are two types of ambulances. I'd like to know about the facilities and the training of paramedics, because recently there have been accidents related to ambulances. So I'll talk to the administration. Yes, there is a kind of ambulances under the Fire Services Department and another under the Security Bureau. Yes, I'll talk to the administration about that. All right, if there is nothing else from members, let me make a summary. We have a number of issues: public health and lead in water incident, women's health, and thirdly, the commencement of operation of Kai Tak Hospital and Queen Elizabeth Hospital, regulating the beauty trade, and also the fifth issue, ambulances. And in the upcoming meeting, the administration has also proposed to discuss the hospital authorities' private patient services and patient safety management in HA. So at the next working meeting next week, I will discuss with them the priority of these items. So if there are other issues you'd like to raise, please write to the Secretariat so that I can talk to the administration about them. So meanwhile, if members would like to propose another item, please do so. So, last agenda item, AOB. Mr. Wong Ting Kwong. Well, no one has tabled me the schedule of meetings, Appendix D. Where is it? I don't see it. It's on the table. Nothing on my table. I'm sorry, the Secretariat will circulate it again. I suppose this is in the email. But anyway, let me read it out. Well, it's okay. First meeting, 16th of November. No, give me a list, please. Pencil down the dates. And then counting from this date, the third Monday of each month, 4:30. The first meeting will be held on the 16th of November. Sorry, maybe it's just a technical matter. Please refer to Appendix IV. And then two other items under AOB. First, the Subcommittee on Health Protection Scheme. They need more time for discussion, so I hope members would agree that this committee be extended. No objection. Another subcommittee on issues relating to the development of Chinese medicine. Again, they need more time for discussion. So if there is no objection, notice will be sent out to invite members to join these two subcommittees again, if you're interested. And we're also going to report to the House Committee that these two subcommittees would be extended. All right, so be it. So notice would be issued to members. Members, if you're interested to join these two subcommittees again, please fill in the form. Any other matters under AOB? All right, so very speedily we have completed the items. Let's see you again on the 16th of November.